practice systems like pathies and all. So this is a complex system, and person is only one person, and he is exposed to all these various systems with their different looking perspectives. And when a person is sick, basically he or she is always looking for something, so he goes here, there, everywhere. So it's a very much urgent need that we must find some mechanism where we converge, we don't divert. So this is our strength also, and this is our system weakness also. So we have to build on the strengths, and we have to see how the weaknesses and the working at cross purposes, one system blaming other system. So these things can be minimized, and like any other complex system, we have to see what are the strengths, what are the weaknesses, how we can increase the strengths, and how we can decrease the weaknesses, the opportunities. We know that analysts analyze and all. So taking all this together, an integrative system of medicine has been, it should be there, because we must have our own traditional strengths also of our traditional medicine, traditional wisdom which is there, which was there and which is there. So those things need to be combined with the various modern methods and technology. So all these things, but again, as Madam said, NNC Madam said that where we keep the boundary of accountability. So that is again a problem. Like one one system, one pathy, how other path causes some problem. So they cannot, in the truest sense, they cannot use, one person cannot use mixopathy. Like that will be, long run there might be problem. But there are ways where we can absorb the good things from one system to other. Like if we get our MPBS allopathic system get orientation, mandatory orientation, then they get some exposure during their, especially the parts where things differ, but there is a lot of good things like yoga. Yoga has already been, Madam is from NNC, so I'm on her behalf, I'm saying yoga is already been sort of, mandated 10 hours, I think. Foundation course, 10 hours have been mandated. And other system, Ayurveda and all, we can propose that there will be some kind of orientation, short orientation for both sides. The modern medicine method should know the others, and already in the Ayurveda system and other system, the curriculum itself has a lot of exposure to modern medicine, anatomy, physiology, even medicines, then their internship. So many things are there, but thing is that we, being ethical, ethics have come up in many these things. So ethics is a very confounding word definition, that beneficence, being helpful to the beneficiary, and non-maleficence means not being harmful. So that should be the idea, that our systems, the paper is being sort of, policies being framed.
Do no harm. Do no harm.
That is the first principle actually. And that integrated system, where each one can know, at least knowledge part they have, and they understand a little bit of the other system. And practicing, yes, practice that is subject to, there might be some positive things, might be some negative things. So one should try to promote their own system, and but be respectful and know other systems. So at this point, that is the thing, both in education, in clinical practice, in research, sort of think ethics, all of us are basically ethical, but we have to, hone that thing, sometimes because of some other things, especially in today's context, when not only these pathies, we have so many digital things where artificial intelligence is slowly creeping in our healthcare system. So many things. So basic our guiding dhruv tara should be the beneficence of person and non-maleficence, not doing any harm. So that is the thing, the mantra for integration.
So ma'am has beautifully enunciated the Acharaniya and the Varjaniya for the healers, for the doctors and clinicians. So nicely ma'am. I would also like to invite from AIMS Raipur, Dr. Tripathi sir, to please come to the dais and contribute to the panel discussion.
So
And Dr. Birmani ma'am also to
so while sir comes here, I'd just like to raise a couple of points, ma'am, leading from what you just said. That ma'am, we know the problems, and in a funny way, the world is moving from specialization to integration again. And as you said, convergence and integration are really critical components of delivering good care. And I think there's no question that the patient as an individual has to be looked at. But in an odd sense, ma'am, all of life is mixopathy. Because if I say that only I as a medicine person will treat you and the surgeon has no role in it, or if the surgeon becomes over clever and says, I will do everything and the medicine person has no role in it, so already we've got a mixopathy there. In addition, ma'am, I think it's inevitable, and I think it's fortunate that we've got exposed, we've got the ability to use that I have a skin problem, I go to the dermatologist, but in addition, if I can use homeopathy on the side, or I have a huge liver problem and the Ayurveda is also helping me a little, where I think it's important is that we need to have knowledge of the systems in a cross manner. Now, it's not possible humanly for all of us to know everything. But already, I think it's wonderful how our country is moving in a very sensible way to getting more mixopathy on the medical curriculum, so that MBBS students know a little bit of this and they know what they don't know. That at this point we need to back off and say, ye mere ko nahi pata, instead of my prescribing Ayurvedic medicines which I haven't a clue about, or for that matter, as Vinay rightly pointed out, the Ayurveda treating something for which he has no clue about. I mean, we are constantly being hamstrung. I'm a pediatric endocrinologist, and we have great Ayurveda people, or rather yoga people, who say that they can treat type 1 diabetes. And in a sense they do, because they kill the child, so that's a complete treatment. Uske baad to farak hi nahi padta. If we can have a system where both at the regulatory level, ma'am, and that's where Niti Aayog is so critical to the process, and at the educational level where NMC becomes important, to recognize that only one person can't be the responsible person. We keep saying, what are the responsibilities of the doctor? Fortunately, I think it is being focused on that there is something like the responsibilities of the patient. I can tell somebody to come after 3 months. Yesterday I saw a boy who came after 4 years, and he's in a mess. And then when he develops complications, to say it's the doctor's fault because I've been seeing her for the last 6 months, forgetting completely that for 4 years I was not going to go to his house and treat him, means that you're subverting systems to the point where the person who can treat can't, who should be able to treat can't, because there isn't any faith and there's no accountability. Second thing is, if for 4 years he goes to somebody who can't treat him at all, and he mixes up things and then comes back with complications of the treatment, then again, it's not one person's responsibility. So for the think tanks of the government, I think it's important to lead us into a situation where the legal system recognizes that everybody has to be accountable, whether the homeopath or the Ayurveda or the naturopath or the patient or the allopath. It's not one person who should be held accountable and everybody else is hum to azad log hain. And at the same time, all of us know enough about the other systems that we know what we don't know and we know what we can't treat. And also then, I think there's a lot of emphasis today of, for example, in documentation. That we have systems where this documentation is recognized and judgments are given early so that neither the patient nor the doctor of different specialties is left hanging for years on end, and no judgment comes. So if we can have a system where we are expected to see 300 patients in an OPD, you can't go home till you finish your OPD. Let there be a system correspondingly with the legal system where they say कि आपको इतने खत्म करने हैं. Now sometimes what happens, ma'am, when I'm seeing 300 patients, I make mistakes. All of us are human beings. That is more acceptable than to tell a patient कि तू 6 साल बाद आइयो because तेरी अभी बारी नहीं है. If we can have a system where everybody is accountable, I think we progress much faster. And where we insist that do no harm should be on both sides, that we have a system which works for the fairness of everybody. Again, utopia it's not easy to achieve, but I think that's what our targets should be.
Sure. Because you are practicing,
Yes, ma'am.
so you know where the problems are, really are. And that is exactly what I was trying to tell, that a lot of weakness in the system is there, and
Yes.
one of them you pointed out is that documentation. We really don't have the habit of documenting. It's very poor for a patient, like you said. Doctors are so overworked, and and the importance is less. We really don't document. So these problems, like accountability part, that and the legal system coming into it. So this will solely depend on having a proper documentation, and that way also we are trying to progress, giving a unique ABDM, so that wherever that same person goes, wherever every practitioner, every service provider sort of enters things, so that way things will move, because all this creation is because no one knows where a person is going, what he is getting. Some practitioners, they give, even not only other system, even medical system, they put in syrup something and then they give. So no one knows what is going inside. So that we have to work on a lot on that, because our system and so much of accountability lies within us. We are very scared that ठीक ठाक लिखा तो कोई पकड़ लेंगे, है ना. मतलब this is one of the major mental block in practitioners in writing down what something they will ineligibly write. क्योंकि many don't have, I'm not talking about medical colleges and all, but many in the practice, they are scared of writing down actually what they are getting, because कोई पकड़ लेंगे तो see, things cannot improve like that. So we need workers, health workers, we need ethical health workers, we need their quality and education. So many things are there.
Dr. Minis would like to speak, sir.
I think we are at a crossroads. India is in a very confused state right now, because on one hand we feel that there is so much of patient population that only allopathic system cannot take care of everyone. So we will take care of every pathies, and which is perfectly right for the country like India. And as ma'am said, if you see 300 patients, there will be a few mistakes, but for the bigger good, if you see, it's a better system. But when it comes to people who are accountable, say we allopathy doctors, for them we start to follow the American system of legal, where you want to do everything possible, very expensive, and then you take them to the task. So only those who are law-abiding citizens are taken to the task. The ones who are non-law-abiding are left scot-free. So we have to somewhere decide on priority at a higher level that, okay, fine, we have a huge population to take care of. And for the larger good, if we want to relax, then we relax for everyone. We want to become strict for everyone. And you have to also safeguard the interest along with policing us. So that is one thing that is actually, as a medical fraternity, you find it lacking. Because there are newspaper articles that talk about washed up surgeries, there is nothing done against them. No, and every time this thing comes in, besides that individual doctor facing the penalty, the whole trust between the patient and the doctor goes away. And there you're doing irreparable harm. And we all know as medical professionals that not a single person in this world has got 100% success rates. So one complication being called as botched up and butchered, and there's so many words that are used, the whole dictionary is used out there. So I think something has to be done so that, yes, I would like the medical profession to be policed and monitored, because we know there are enough bad fish amongst us. No one denying that fact. But on the other hand, the same person is policing you. Like if I'm taking care of my staff, if they do something wrong, I'm going to take them to the task. But then I'm also going to stand by them. Now that feeling of someone standing by you is missing in the system. So that is something that I think we have to all think about.
Very, very important points.
And there are so many areas where the patients can go to their multiple, he can go to police, he can go to NMC, he can go to SMC, he can go to these things. There should be one uniform thing and a uniform policy when it comes to medical malpractice, where there has to be a doctor involved who understands the thing, rather than someone like my wife who doesn't know anything about medicine and then she's passing judgments on the doctors.
True,
So
sir.
it's not fair.
This is a very important point that you said.
Just
Yeah.
few
He knows the
minutes.
doctor.
Let's just add.
He knows the doctor.
That's another one.
Just like to add to all three views.
Sir,
At Swami Vivekananda Swarth University, Meerut, we have developed a new department. It is a unique department. The oncology department, palliative care department, has formed a new. It's a very recent one. Has formed a new comprehensive, holistic, multidisciplinary approach. Now, what we are doing there is a person from medicine, a person from oncology, a person from radiology, a person, all related person, as well as Ayurveda, naturopathy, homeopathy. All of them are there together. Like the tumor board, they sit together, discuss about a patient, and then they decide what is best for the patient, and then they implement it. Whether it is mainly because for palliative care, maybe post-surgical, maybe pre-surgical, or pre-radiology, post-radiology, whatever it is, or end-of-life care. So what we do is, what is best for the patient. For example, if the patient is having simple pain symptom, the first line of treatment will be non-pharmacological. If it is not improving, then we go in for the next stage, that is pharmacological approach. Even then, if it is not going, then for surgical approach. So that is what approach we are finding. So I think, of course, I don't know whether it is legalized or not or something like that. I am speaking out of my mind. But then this is how we have to work on improvement of the healthcare system for the patient, because the quality of life of the patient is more important rather than which system is being followed.
And you see, sir, how it works out is, we screen every newborn for the thyroid test. I don't have to teach it to my postgraduates. When they were training, they saw this happening. So when they go out into practice, they will do it automatically, because ये तो ऐसे ही होता है. When a child has been watching the oncology board giving holistic care, they don't even have to be taught formally. They pick up these values. So if we have, and in an odd way, it's very exciting because in an odd way our country is not very confused right now. So many things are happening in a very positive way, because I don't think we could imagine 5 or 6 years or 10 years ago the kind of changes which have been achieved in the country. Things are really moving forward. So we can have discussions like this. Somebody was telling me about how wonderful a country China is. I don't think we can have discussions like this in China. We can't have discussions like this perhaps in many countries where we can criticize each other in a...
You talk of utopia only when you expect something to change.
Yes. So that in itself, I think, is a very positive thing, that we are in a position to think about things, to expect that changes will happen. So when a single institution sets up an integrated board, all the students were exposed to it, all the practitioners were exposed to it, all the patients were exposed to it, will automatically learn those values without even having to be taught. If we can have a system, and that's where Niti Aayog becomes so important, because an individual organization or board can't do it. If we can have a system where all medical colleges are integrating the pathies from the beginning, and therefore the student is exposed to the different pathies, and automatically then research becomes more integrated. I have to talk to the Ayurvedic college to do a study, वो one end of city है, मैं one end of the city हूँ. If that person in the Ayurvedic thing is just 4 floors away, it becomes that much easier. Once research starts taking place, we can actually integrate into medical care. Once research starts taking place, you know who knows what and what is not possible for this and what is possible for this. 40 years ago, Dr. M.M.S. Ahuja did research in Madhusar. He found it was effective. It never went further because the pharmaceutical industry didn't pick it up. We have a lot of openings in which we can give our patients much better care in a cheaper and a safer way. And this is a country which has taken people, taken a vehicle to Mars at 1/5 the cost of anybody else. We do things to Mars what people can't make a movie out of. We have the capacity to lead the world in this. If organizations like the Niti Aayog can not only formulate policies but also start cracking the whip. एक ही जने को बार-बार पकड़ के मारेंगे नहीं. If we can have accountability across the board, so that I know that if I'm being punished, I'm being punished fairly, and the other person is going to be punished if he's at fault. Also, it's just not one person being picked up, because then the demoralization that takes place and the defensive treatment that starts happening is very destructive.
See, I think this is in our this thing, having bodies which can actually talk to each other and sort out these problems. I feel that basically all these malpractices which are being talked about here, and all this patients harassment and patients this thing and doctors harassment, all this because some inherent weakness in our healthcare system. We don't have enough providers.
In our
like
system,
that.
not healthcare system, in our system. Healthcare system कितनी गलती नहीं है जितनी system की गलती है.
नहीं, system में infrastructure, the beds, if you see, beds, how many ideal, I think national policy says 2 per 1,000 beds. We don't have, we have hardly, I think.
Yeah, perhaps Dr. Devedi might like to the narrative because the new aims which have been added upon.
Parties,
Yeah,
if you
the
could
efforts
first the
are
party,
on,
yeah.
because we see all these things happen because we are working in a system which is not enough to, for everyone.
And someday we have to encourage our doctors also, because I see in Uttarakhand, I'm practicing in Ranikhet, Uttarakhand as a GP ma'am, and you would not believe that so many healthcare services are being provided by the pharmacists, the medical shops, chemists, and they don't even have a D pharma or a B pharma license, and they're giving away antibiotics and God knows steroids and what not. And the state chief medical officers and all, they're just not able to, I don't know what, due to what system. I am getting my clinic license renewed regularly, but there is nothing which can, so we are trying to approach the authorities to at least create an awareness. If something could be done, maybe we could train and orient at least these pharmacists. You cannot stop them from dispensing drugs, but there needs to be a creative, constructive pathway to converge into have ethical and good clinical practice. That's one. And second one, also I would like to give a request to the Niti Aayog and to the government to say that if we can have a nationalized medical record server or something of that sort, if a patient is coming to a government setup and then he goes to a corporate setup or a private setup, how can we converge the private, the government, the corporate? So nationalized MRD, if we each patient, like we have an Aadhaar linked and a medical record system. Yeah.
APDM is there and electronic health records. This is happening.
Yeah.
It
Massive
takes
project,
time.
and
Yeah.
India is the only country which is working towards that, and
So-
hats off to India for thinking
Yeah.
about it also.
So this is great. I'm not very aware of this. I thank you for making me aware for this, ma'am. But this is very much needed, and I wish if this can go layers down, because the convergence between the corporate, private, and government first, that is one challenge. And then of course, if electronic medical records, like you said, documentation. So when a doctor is writing a prescription, when legible and illegible handwriting question comes, so how, I would also like to know about the views of Madam Dr. Juvenmani ma'am and Dr. Vinay Girodia sir on the EMR, like how it is for doctors as clinicians to use electronic medical records versus handwritten prescriptions, because this is an important
I have a
issue.
horrible handwriting. Thanks to that, I was a very early adapter to EMR. Within 1 year of practice, I was on EMR.
So,
And that's a game changer. That's a must
game
requirement.
changer.
So I was blessed with that.
so ma'am, I think you could help the doctors to adopt that through regulation also, if in some manner.
But you have to
It's a
see
food
Dr.
for thought.
Vikmani's work.
Okay.
How she manages to write the detailed workup on the
In
sheet of
legible
paper,
writing.
legible writing, and that beats any EMR. So I think the ideas and
Sir.
insights should be there.
So, Dr. Tripathi,
Thank you so much, the founders of Rethink, for inviting us to part of this interaction. And as I was not prepared for the panel, just I'll be brief about what I think. And I'm heading a department of trauma and emergency, so I see all kind of patients. So I see a patient who has been diagnosed with chronic kidney disease, who has been advised to undergo regular dialysis, but the patient had taken 10 dialysis.